welcome to this sponsored session from Inside LifeTech. My name is Emanuele Barbato, and today we'll discuss about the contemporary adoption of invasive coronary physiology with microcatheter-based technology. We are here today mainly to address the three important points. The first one, we'll try to understand altogether the role of microcatheter-based physiology, also through a critical appraisal of the literature. We'll try to know how to correctly adapt the novel TruePhysio microcatheter, and we'll discuss the importance of physiology assessment to plan, optimize percutaneous coronary intervention, and why not also to assess its final result. Now, without further ado, I'd like to introduce Salvatore's lecture. So let's hear what he has to say on this topic.
Thanks, Emanuele, for introducing me. So it is my pleasure to start with this interesting topic. So first of all, we should ask ourselves why we need this microcatheter-based FFR. So to me, there are two main reasons. So we see which is the difference between these two technologies. So the pressure wire, as we have said, so there is a pressure sensor which is around 30 millimeters from the distal tip of the wire itself. Whereas in the microcatheter-based FFR, so there is the pressure sensor which is located very close to the distal tip of the microcatheter, and it is quite easy to locate because we have two radiopaque markers in between the pressure sensor, and we can go as a microcatheter so on the top of our workhorse wire.
I think your points are very reasonable, and I'm curious to see whether the colleagues in Aalst actually adopted the microcatheter, the TruePhysio microcatheter in the way you suggested. So we are ready to go to the cath lab and see the case they performed for us.
Thank you very much, Emanuele, for this very kind introduction. It's an honor for me to introduce this excellent team in the Cardiovascular Center in Aalst. Next to me, somebody that does not require introduction, Bernard de Bruin. We have our nurses, Tom and Eddie, and I think we will start by a case introduction.
So the goal of this session will be to interrogate the tree vessel with invasive measurements on the basis of this Inside LifeTech TruePhysio catheter, which is a microcatheter to measure the fractional flow reserve.
You feel that the shaft is quite rigid, which gives you some push, and the distal part is quite flexible, which makes it really an easy catheter to cross tortuous vessels, also stent struts, for example. So first thing we have to do is to equalize the catheter. So we go with the two radiopaque markers just at the tip of the guiding catheter to equalize. Perfect. So after the equalization and confirming a PDPA value of 1.0, we push the microcatheter down. The pressure sensor is almost at the tip of the catheter. You see the markers in the in the distal posterior branch, and now we're ready for a measurement. Okay, so Bernard, I see you preparing the syringe for an FFR measurement. You will use intracoronary papaverine.
That's it.
You have flushed the line with some saline, and you're ready to start the injection. We see a PDPA value of 0.93, and I think, Bernard, you're ready to make an injection with some intracoronary papaverine to measure fractional flow reserve. Okay, injection with papaverine, then you have to wait for 10 to 15 seconds. Okay, then we see the PDPA going down, 0.72. We have some stable hyperemia, and then, if you agree, I will do a pullback. Okay, we start the pullback. It's very easy with this rapid exchange catheter to perform a pullback. We will see if there's a gradient in this distal lesion, and then you see during the pullback the PD value going up, and we will confirm again a PDPA of approximately 1 at the tip of the guiding catheter, and that is the case.
So we are ready for the control fractional floor reserve, so post-PCI fractional floor reserve. In the distal LED, you remember that there were 2 lesions which angiographically were at least dubious, and we hesitated to treat them on the basis of the fractional floor reserve measurements before, and especially on the pullback we decided finally not to do it. Now we go for, you can record, this is the resting gradient, almost equal to 1. We are going to induce hyperemia. That's it. So there we go, and we are now looking at the distal pressure signal, and you see that the the PDPA goes to 0.88, 87, 88, and here we have a plateau, so that is very reassuring, very reassuring. You can pull back, Jeroen, even though a pullback when the pressure gradient is very small is of course always a little bit difficult to interpret, even during hyperemia, not to speak of the resting pullback. There we are in the guiding. It's obvious that this LED is no longer hemodynamically significant, that we are done. Okay,
I agree.
So we are going to have a look to the final angiograms together. So thank you, Jeroen. It was a nice demonstration of a complete functional revascularization of a young patient, very physically active still, based on the fractional floor reserve measurements and pullback of these pressure measurements. I think it is impressive that we have done 8 measurements, including 8 pullbacks with the same catheter just over our workhorse wires, and this allows, of course, to be very flexible and to be to perform many of these measurements during these relatively complex procedures.
Let's start first with Jeroen. What is the compatibility of the TruePhysio microcatheter with 5 French guiding catheters, Jeroen? Can we do that?
Well, thank you, Emmanuel. It's very good question. Yes, it's possible. If I remember well, it's a 1.6 French size. So this fits perfectly within a 5 French catheter, and it's very useful in the 5 and 6 French, indeed.
Now I have another technical question to Jeroen. Colleagues were interested in the storage of the data on the console. Can we do some post-processing, some changes, fine-tuning of the measurements?
Yes, it's a console that is mirroring a little bit what we have been used to past, so you can readily access the data, move your cursor. So I think it's a very convenient, very easy to use device, both the catheter and the console.
And I'd like now to move on to the next lecture and introduce Carlos Colette with this topic. Carlos.
Thank you very much for this kind invitation to participate in this symposium. The idea will be to extend what has been described by Dr. Brugaleta on the different characteristics of the microcatheter and wire-based devices for FFR in this talk entitled Microcatheter-based FFR to plan and optimize PCI and to assess the functional results. My name is Carlos Colette. I'm an interventional cardiologist, co-director of the cath lab in EuroPCR in Belgium. So we are going through, or we're leaving the expansion of FFR from a first method to assess lesion significance, now to a tool that allows us to understand, one, the pattern of coronary artery disease. I'm thinking about focal and diffuse disease that can be quantified, by the way, by the PPG, and to optimize the PCI using FFR pullbacks. But I want to make the emphasis that for this specific a part of the expansion of FFR, is very useful to have microcatheters because it allows you to go in and out pretty fast to these pullback maneuvers and optimize your results. I'm going to show you some cases that really changed my practice in the last 2 or 3 years. As you see in this slide, you see a right coronary artery with this diffusely diseased from the proximal part to the mid-segment and the distal part. But when you do a pullback curve, you start to understand better that this is not a function, this is a functional focal disease and not a diffuse disease. And this changes completely the plan and the strategy to treat this coronary vessel. So we can conclude that the coronary physiology is expanding from a diagnostic technique to a tool that will help us plan and guide our PCI. New indications demand new devices that can be used several times in complex anatomy and several times post-PCI. The microcatheter in this regard facilitates the pullback maneuver and the assessment of post-PCI FFR. But we need further clinical trials indeed to confirm the benefit of this technology. Thank you very much for your attention. So I see that in the planning phase, there are 2 questions that we need to answer. One, is the lesion significant? That is addressed by measuring 1 point in the distal part of the vessel. And the second one, is this a good vessel to do PCI? In other words, do we have a functional target for it? And for that, we need to do a pullback. And this is where I see that the microcatheter technology may have a good place in the cath lab, because facilitating the pullback maneuver is something that will increase the information that you have concerning the coronary physiology and the disease in that particular vessel, that will help you do a better PCI and having a higher functional revascularization as measured by the post-PCI FFR. This is extremely important, Emanuele, in complex anatomies, as Salvatore showed, and also in cases with severe calcification that you don't want to rewire. I see in these cases the microcatheter could help a lot facilitating all these maneuvers.
You mentioned to the PPG. Yeah, that's an interesting concept. It's going really to change our clinical practice and the way we select the lesion to be treated. The lesion not just to be seen on the angiogram, the physiology lesions to be treated. This has been validated with pressure wire, Carlos. Any thought whether this can be applicable to microcatheter? I guess, Carlos, for some reason, you're there. Any thought whether this can be also applicable to microcatheter technology?
Yeah, so the PPG actually can be calculated from any pullback curve. And indeed, what the microcatheter offers you is the ability to perform this pullback curve more easily. So I think it's a big yes. And as you mentioned, Manuele, we're moving FFR from a one-dimension metric to a two-dimensional approach, trying to understand a little bit more the information coming from the pullback. And this is indeed something that will grow with the microcatheter technology.
There is a very last question from Sonia. I was asking, in light of angio-based technology, angio FFR, VFFR, and so forth, whether we need this additional tool, this microcatheter-based physiology. Well, my simple answer to Sonia and to the colleagues is simply yes, why not? With this, I'd like just to draw 2-3 final takes. Yes, we have a new device. We learned how to place this device in our procedures. There is much more to come, because most likely this device will also be used to assess the functional distribution of the atherosclerotic disease within the coronary artery. We heard the near future, the potential application of PPG, even with this technology.
To transform healthcare through innovation and quality.